Good afternoon to everybody. I'm waiting for the slide.
Yes. Can we have the slides, please? Thank you.
Okay, I would like to talk about developmental profile in children with autism spectrum disorder using a tools that is a psychoeducational profile revised. And one of the main questions in our field is how symptom and behavioral change over the time. And to do this, we need a repetition of the assessment for the description of normal and abnormal trends. But in particular, we need longitudinal study that provide opportunity to describe the symptoms over time. Just about 10 years ago, Peter Samari, publishing on American Journal of Psychiatry, tried to do this, following over a period of 2 years children with Asperger's syndrome and classic autism. He found that verbal area is one of the predictors of a good outcome, also for children with autistic disorder, classic autistic disorder. So our aim is to compare the developmental profile among children within the spectrum of autism disorder followed over a period of 3 years. Our group was composed of 25 children with ASD, in particular 9 with high functional autism, 8 with PDD-NAS, and 8 with autistic disorder, classic autistic disorder. We did a first evaluation that was assessed between 24-47 months of age, and then after this we did other 2 additional follow-up, respectively at 4-12 months and 12-36 months from the first evaluation. We assess using PEPR, and that provide information about imitation, perception, fine motor, gross motor, hand coordination, cognitive performance, and motor and cognitive verbal area. And at the final of the test, we have a developmental quotient that we can classify our children. So this is the baseline of the profile. As you can see, in gray is a normal range, and sorry. Okay. In gray is normal range. As you can see, all 3 groups are below the normal range. There is a significant difference just in gross motor for autistic disorder, and all the other areas are below the normal range. As the second follow-up, you can see the profile of high functional autism that is very homogeneous, whereas the profile of PDD-NAS and autistic disorder is heterogeneous, with a lower score, in particular in imitation, in cognitive area, and in verbal area. So we did a correlation between final developmental quotient and baseline developmental quotient and other area, and we found a positive correlation that means that is a positive predictor for a good outcome, in particular for a baseline developmental quotient, as well as for high-hand coordination, verbal area, and cognitive area. This is not surprising results, because also Peter Samari found in American Journal of Psychiatry publishing that verbal area and cognitive area are a good predictor for positive outcome in these children. Then, so I would like to show you the developmental quotient throughout the time, baseline, first follow-up, and second follow-up. As you can see, there is a parallel over profile trajectories between high functioning and PDD-NAS, whereas the profile of autistic disorder is lower in comparison to other 2 groups. So, in conclusion, we detect a peculiar pattern of the development in HFA in comparison to PDD-NAS and classic autism. And we believe that an early detection of typical behavior patterns using PEPR is very useful clinical tools to recognize ASD subtype and predict outcome. And this is important because it's crucial to manage a behavioral problem, but it's important to start a treatment that is more appropriate to a specific diagnosis. Thank you.